Good morning. My name is Ana Miguel. I am part of the EUCAIM EDIC Coordination Team, and I'm here today to introduce you to the prospective EUCAIM EDIC on behalf of the EUCAIM Project Consortium and the EUCAIM EDIC Working Group. In my talk today, I will cover what EUCAIM is, the needs it addresses, and the benefits that its establishment will bring in the long term for the European Union. I will then introduce you to the prospective EUCAIM EDIC and walk you through the different steps that we have taken towards its constitution thus far, as well as through the benefits that contributing member states can gain from joining the EDIC. So what is EUCAIM? EUCAIM, also referred to as Cancer Image Europe, is a digital infrastructure designed to provide access to cancer imaging data for secondary use in research and industrial innovation. The data made accessible through the infrastructure entails different imaging modalities such as MRI or CT scans, linked to the clinical data that is included in the patient's medical history record. EUCAIM was originally born as a multi-country project, which is the cornerstone of a European Cancer Imaging Initiative, which along is one of the flagships of Europe's Beating Cancer Plan. Pilot version of the infrastructure is currently being deployed by the EUCAIM project, an ongoing 4-year initiative co-funded by the Digital Europe program that started back in January 2023 and will come to an end in December 2026. The EUCAIM consortium, currently working on making this a reality, brings together other already established major European research infrastructures, as well as cutting-edge hospitals, universities, and key industry players in the pharmaceutical, medtech, and biotech industry. We are now ending the 3rd year of the project, and the infrastructure is already in operation. You can watch a demonstration video of how data access via the infrastructure works in practice by scanning the QR code on the right-hand side of your screens or by visiting the project website and social media channels. Upon the end of the EUCAIM project phase, which is bringing the pilot of the infrastructure to life, our ambition is to consolidate EUCAIM as one of the main European infrastructures of excellence in the EU. And as part of this talk today, we're going to explain how we plan to make that happen. So that you know how everything works in practice, EUCAIM has been built as a hybrid infrastructure whereby the core operations are run at a central hub, which is connected to a large network of federated nodes across the EU. These nodes are hospitals, research centers, and other research infrastructures that can make this imaging data accessible through the platform to allow experimentation with such data within it. This central hub, through its main dashboard, allows for any necessary component to browse and search available datasets, submit data requests, negotiate data provision with the data holder, then facilitate distributed processing in a secure processing environment. So what data is made available through EUCAIM and how? On one hand, EUCAIM has the capacity to store and hence make available for reuse data that has been already prepared through the execution of former research and development projects in the field of medical imaging. These are stored in what we call the Atlas of Cancer Images, which is in essence a space where data previously used for research and innovation purposes can remain available for further reuse in the future. On the other hand, and in the event that none of the data sets contained in the atlas are what the user needs to fulfill their specific needs, EUCAIM can also provide real-world data on demand. What this means is that by placing a specific dataset request, an innovator can access this data from whatever hospital or research center in the EU that data is available at, EUCAIM acting as a mediator in this data provision process. With this, we're building EUCAIM as the one and main access portal for cancer imaging data in the European Union. So we say that EUCAIM unleashes access to cancer imaging data. But what is the benefit of having access to this type of data? What would someone use it for nowadays? Cancer imaging data is currently being used for the development, training, and validation of AI models that are being built to act as decision support systems for radiologists and oncologists. In other words, AI that will assist a clinician while making a diagnosis or allocating treatment. Once created, these models can then be integrated into innovative technologies that will be deployed throughout the European healthcare systems, a key one of them being their integration into cancer screening programs, for example, which is where medical imaging can really make a difference, allowing early cancer diagnosis. Through enhanced cancer screening programs and as a result, streamlined healthcare workflows, we expect to be able to significantly increase early detection rates for cancer. And being early detection so essential to beating cancer, we expect that more precise screening devices will significantly reduce cancer-related mortality rates in the EU. This is how EUCAIM fits into the bigger picture of Europe's Beating Cancer Plan as a key first foundation pillar to making all of this possible. To this very aim of accelerating AI development in healthcare, EUCAIM not only provides access to the necessary data, but has actually been built as an all-inclusive platform for AI experimentation, containing everything that is ultimately needed for this purpose. EUCAIM provides access to the data, but also to any necessary data preparation and preprocessing tools, as well as AI modeling tools, all contained in a secure processing environment that has been designed in compliance with all applicable EU regulations. As previously mentioned, the core EUCAIM operations where all of these services will be centralized is known as the EUCAIM Central Hub. And it will be the Central Hub office team and services who will provide 360-degree support throughout the entire user journey, making technical and legal teams reachable behind a help desk to support any necessary steps in this experimentation and ensuring that any action taken within the platform is also done in compliance with any applicable EU regulations. These are the different operational units we have designed for the Central Hub office, which, as you can see, in addition to legal and technical support teams, will also count on business development support teams, training and outreach services, and IPR counseling services, amongst others. Based on everything that EUCAIM provides, we expect that any public or private institution working on the development and deployment of innovative digital technologies in health, and more particularly of AI solutions for cancer care, will find EUCAIM to be a crucial resource for advancing their development and associated businesses. Why so? Because as things stand right now, these industries largely rely and depend on the availability and variability of large data sets to be able to test, train, validate, and eventually achieve regulatory clearance for the digital health technologies. Being EUCAIM a holistic facilitator of all this, we expect it to eventually become the go-to platform in the EU for all of these type of industries, but also for any research and academic institutions that are working on related developments. Now, how are we planning on making EUCAIM stable in the long run? Because of the large focus and impact on industrial innovation, we're planning on articulating its sustainability in the form of a European Digital Infrastructure Consortium, or EDIC, upon project end. What this will mean in practice is that the Central Hub operations will not only be maintained beyond the project phase, but also enhanced over time, allowing new data holders from countries currently not represented to be onboarded, and hence expanding the geographical representation of the Federation, including new cancer types currently not yet available. For an EDIC to be established, financial contributions from at least 3 EU member states are required. The current EUCAIM scheme implies that those countries financially contributing to the EDIC operations will be able to rely on and make use of all the services provided by the central hub, and with that, significantly accelerate their capacity to train, validate, and benchmark AI solutions to integrate them in their healthcare systems more efficiently. With regards to how far we've come in the establishment of the EDIC, we formed the EDIC working group back in early 2024, which today counts with the presence of scientific and ministerial representatives from 16 different countries, Spain having nominated itself as a host country for the EDIC, as Spain is where the central hub office will be physically based. It is for this reason that the working group is currently led by representatives of the Spanish Ministry of Health together with Spanish Ministry of Digital Transformation. The main achievement of the EDIC working group over the course of last year was the submission of the pre-notification of EDIC application, where the main objectives, implementation strategy, and timeline for the implementation of the EDIC were included, amongst others. The pre-notification was submitted in January 2025 this year by the Spanish Ministry of Digital Transformation with supporting letters from France and Latvia. We received feedback on the content of this pre-notification from the MCP Accelerator in late May 2025. And where we're at now is on drafting the statutes, keeping into consideration and implementing this feedback received. Understanding that the timeline for the actual establishment of the EDIC will be uncertain, our ambition is to submit the formal EDIC application over the course of 2026 before the end of the EUCAIM project to minimize as much as possible the gap period between the project and the start of EDIC operations. With this presentation, we would like to officially invite you to represent your country in the EUCAIM EDIC working group if you're not part of it yet. So you can both benefit from and contribute to making the EUCAIM EDIC a tangible reality from here on until the end of the official EDIC constitution. And we would like to encourage you to join by further highlighting how EUCAIM can enhance your country's innovation ecosystem all throughout the healthcare support chain, from helping data holders and industry players to helping your country align with EU public healthcare policies. So, what would be the benefits we anticipate your country will gain from financially supporting the EDIC operations? First and foremost, EUCAIM will help you generate high quality, AI ready cancer imaging datasets more efficiently and at a lower cost, as the entire operation to making this possible will be already set up and running for your country without the need for it to be implemented from scratch. At the same time, data holders that are part of the federation will be assisted by EUCAIM to align with the European health data space requirements in terms of the maturity that is expected to be achieved at their data warehouses, while being granted the possibility to license the use of their datasets and get compensated for the costs incurred during data preparation. As previously explained, all this together will help accelerate innovation at startups and SMEs in your country that are working on AI solutions, making them more competitive across the EU, while speeding up your country's ability to release AI solutions into the market. And last but not least, EUCAIM can help your country strategically align with the current EU regulations and requirements pertaining to health data sharing. This is because the data sharing process in EUCAIM has been built to be in full compliance and following recommendations of the Data Governance Act, the European Data Act, and the recently adopted European Health Data Space Regulation. At the same time, EUCAIM's data access request process is in full alignment with what will be requested of a health data access body of the European health data space. In fact, and precisely because of this and because of the way all the technical implementations have been set up in the infrastructure, one of our main strategic objectives for EUCAIM is to make it an authorized participant of the Health Data EU platform. The infrastructure will be fully aligned and connected with it and will work closely with health data access bodies, ensuring the necessary level of security, data protection, and robust governance. Because of this, we also believe that EUCAIM can serve as another key reference example for the implementation of national health data spaces and health data access bodies in your country, specifically in the realm of medical imaging, and with that, further contributing to defining the standards and best practices for the implementation of the rest of the health data access bodies in other medical fields. With this, I would like to thank you for your attention, hoping we have shed more light into what EUCAIM is and what it brings to the table for the near future. I'm leaving here the link to the EUCAIM website for your reference, where you may find more information, and also our contact email at the EUCAIM EDIC Coordination Team, should you wish to contact us in the near future, which we very much hope you do. Thank you for your attention.